The most effective way to prevent COVID-19 is not to get vaccinated. 1. Personal protection measures. Wear a mask properly. Use a medical mask or N95, KN95, meeting the standard of filtering 95% of small particles in crowded places, closed spaces, or when in contact with people at risk of infection. Cover your nose and mouth. Change the mask after 4 to 6 hours or when damp. Do not reuse disposable masks. Wash your hands regularly. Wash your hands with soap and clean water for at least 20 seconds, especially after touching public surfaces, door handles, elevator buttons. If soap is not available, use an alcohol-based sanitizer containing SARS 60% alcohol. Keep your distance. Avoid close contact, 2 meters, with people with symptoms, coughing, fever, sneezing, or in areas at high risk of infection. Limit large gatherings, especially in closed spaces. Clean surfaces. Clean frequently touched surfaces, phones, tables, doorknobs, with 70% alcohol or disinfectant at least once a day. Avoid touching your face. Do not touch your eyes, nose, or mouth because the virus can enter through the mucous membranes. 2. Enhance natural immunity. Balanced nutrition. Vitamin C. Eat oranges, kiwis, bell peppers, 100 to 200 milligrams a day to support white blood cells to fight infections. Vitamin D. Sunbathe for 15 to 30 minutes a day or eat fatty fish, eggs, 5 to 10 eggs a day. Vitamin D deficiency increases the risk of respiratory infections. Zinc. Pumpkin seeds, beef, oysters, 8 to 11 milligrams a day help increase immune response. Probiotics. Yogurt, pickles, improve intestinal microflora, support immunity. Limit sugar. Excess sugar weakens white blood cells. Replace with low-sugar fruits and whole grains. Get enough sleep. 7 to 8 hours a day to help regenerate immune cells. Create a dark, cool sleeping environment. Avoid coffee after 2 p.m. Moderate exercise. 30 minutes of brisk walking, yoga, or cycling, 5 days a week increases white blood cell circulation. Avoid overexercising as it can temporarily reduce immunity. Stress management. Stress increases cortisol, which weakens immunity. Try meditating for 10 minutes a day or deep breathing, 4 seconds in, 4 seconds out. 3. Improve your living environment. Good ventilation. Open windows. Use ventilation fans at home, in the office, or in public places to reduce the concentration of viruses in the air. Avoid staying in closed spaces with no airflow for long periods of time. Use an air purifier. HEPA filters can reduce aerosol particles containing viruses in closed rooms, especially in crowded places. Avoid dust and pollution. Cigarette smoke and fine dust, PM 2.5, damage the lungs, increasing the risk of complications if infected with COVID-19. Use a dust mask when going out in polluted areas. Clean your nose and throat with saline solution. 4. Monitor and respond quickly. Recognize symptoms. Monitor for signs such as fever, cough, shortness of breath, loss of taste or smell. If suspected of infection, isolate immediately and do a rapid test, antigen test. Isolate when necessary. If in close contact with an infected person, self-isolate for 5 to 7 days and monitor your health even if you have no symptoms. Prepare medical care at home. Save emergency contact numbers, 115 or local health. Have a thermometer, SpO2 meter, fever reducer, paracetamol, and spare masks available. 5. Important notes. High-risk groups. People over 65 years old, people with immunodeficiency need to comply more strictly. Always wear N95, limit crowded places. Thank you for watching the video. Wish you and your family good health and happiness.